Okay, let's talk about another condition, which is carpal tunnel syndrome. This is a very common condition, very important as a undergraduate as well as a postgraduate student. What is carpal tunnel syndrome? Carpal tunnel syndrome is it's a group of signs and symptoms caused by compression of the median nerve at the level of wrist. So, in other words, if you have to define, it's a compressive neuropathy of median nerve at wrist caused by compression within the fibrosis compartment, which is carpal tunnel. So, before understanding what is carpal tunnel syndrome, we need to understand something a little bit more about the anatomy. So, let's look into the anatomy of carpal tunnel. So, this is roughly the area of carpal tunnel. So, this is a attachment of the flexor retinaculum. So basically the roof of the carpal tunnel is formed by flexor retinaculum, and it has attachment medially as well as laterally. Medially, the attachment proximally is a pisiform and the hook of the hammer distally, and on the radial side, proximally is a tubercle of scaphoid tubercle and trapezium. So underneath there are 9 tendons and 1 median nerve. So overall there are 10 contents. So the median nerve is roughly around in this area. The tendons are 9 tendons. There are 4 tendons of flexor digitorum superficialis, which cause the flexion at the MCPJ, and also there are 4 tendons of FDP and 1 flexor pollicis longus. Let's look into the etiology of carpal tunnel syndrome. It's common in middle-aged female. Sometimes it can be hereditary. It can run in families as well. It can be associated in trauma situations as well, if there is a carpal fractures, if there is an extensive soft tissue injury around the wrist, or in case of burns as well. There are certain medical conditions which are known to or prone to cause carpal tunnel. For example, patients with diabetes mellitus, rheumatoid arthritis, hypothyroidism, etc. Sometimes people in pregnancy, female in pregnancy, tend to have this condition because of the water retention, the pressure within the carpal tunnel becoming more, and that can cause compressive neuropathy of median nerve as well. So there are certain activities which can precipitate carpal tunnel syndrome. For example, repetitive wrist movements. For example, somebody playing tennis, or a person using a machinery, vibrating tools are prone for this condition as well. Some sports, for example, tennis, and also cycling, where it can decrease the volume of carpal tunnel, can cause this condition. So let's look into the clinical features of carpal tunnel syndrome. So the carpal tunnel has motor as well as sensory supply in the hand. So the clinical features, mainly when the patient comes, are the sensory symptoms. For example, pain in the distribution of the median nerve. For example, these are the 3 fingers which are supplied by median nerve. Sometimes it may be numbness or tingling sensation. Sometimes patient may complain of electric shock-like symptoms. If both hands are involved, dominant hand seems to be involved. The symptoms seems to be more severe in the dominant hand. Night symptoms are classical of carpal tunnel syndrome. It gets worse during the night, and after shaky, some repetitive movements, then the symptoms get resolved as well. Let's look into the clinical examination finding. If you look into the clinical examination, or if you look at the hand, it may appear completely normal in most of the cases, or in severe cases, or in a long-standing cases, there may be weakness in the thenar muscles. And if you look there may be sensory disturbance in the distribution of median nerve. There may be weakness of abduction. There are specific tests as well. So these are the general finding, but there are some specific tests which we can do to confirm the presence of carpal tunnel. The most sensitive test of that is Durkin test, where you press on the median nerve for 30 seconds, and this should cause the symptoms similar to the carpal tunnel. That's a positive test. And the other test is Tinel test, where the median nerve position is here. So gently tapping on the nerve should reproduce the electric shock-like symptom of carpal tunnel syndrome. So that's another important step as well. Another test, which is called Fallon's test, which is done common in the clinics as well, is compressing on the like extreme palmar flexion of the wrist and holding it for example, 30 seconds should reproduce the symptoms of carpal tunnel, and that is a positive test again. So there are other tests which can be done, innervation test and 2-point discrimination test, etc., etc. These are useful for in the post-operative period for assessing the recovery. So how to diagnose carpal tunnel syndrome? It's a clinical diagnosis, but in the recent years, the investigations have become norm. For example, nerve conduction studies and EMG studies. If you look into the report of, if you'll see a patient of carpal tunnel syndrome, and you'll say, okay, there are positive signs, and you send them for nerve conduction and EMG studies. If you get the report, what to look for? If you look into the report of nerve conduction studies, the specific thing you look for is if there is any increased latency. In carpal tunnel syndrome, there is a sensory latency of more than 3.2 milliseconds, and in motor latency of more than 4.3 milliseconds, and in terms of conduction velocity is decreased as well. If you look into the EMG report, you have to look for fibrillations, fasciculations, sharp waves, decreased insertional activity, as well as complex repetitive discharges. Let's look into the treatment of carpal tunnel syndrome. So initially we'll try conservative measures, which can be tried when you send the patient for tests, for example, nerve conduction studies or EMG studies. During that period, you can try anti-inflammatory medication, NSAIDs. You can ask the patient to avoid activities which can provoke these symptoms, and also nighttime splint, for example, future splint may help. And sometimes just injecting a local steroid injection into the carpal tunnel can resolve symptoms substantially. Up to 80% of symptoms can be resolved. Once the conservative measures have failed to resolve symptoms for a long period, then we need to look for operative options. Either this is called a release of the carpal tunnel. It can be done either open or arthroscopic method. Generally, it's done under tourniquet. It can be done under local or general anesthesia. So the incision of the carpal tunnel is very important, and let's look into the landmarks which define the incision of carpal tunnel. So let's look into the incision of carpal tunnel. The landmark is the radial border of the ring finger. So it's a longitudinal line, and another line through the first web space. Yeah, the line extending from there to there is roughly the carpal tunnel incision. For example, it is just slightly ulnar to the this prominent crease, and the proximal extension should not cross this crease. This is very important because there are few structures you can get damaged during the surgery. So basically, your incision is in this line, not to cross beyond this, because there is a damage to the superficial palmar arch. And also, while incising, you shouldn't, incising the carpal tunnel, it should be directed this way on the knife, because the recurrent branch comes from this angle and supplies the thenar muscles. Operative treatment, either open or arthroscopic method, has few complications. Apart from the general complications, the complications specific to carpal tunnel are incomplete release. If there is an incomplete release, the symptoms can recur. Second is there is as we mentioned, there is a possibility of damage to the superficial palmar arch. There is also a possibility of damage to the recurrent branch of the motor nerve. Sometimes proximal extension. There may be damage to the cutaneous branch of the palmar cutaneous branch of the median nerve, which supplies the thenar eminence. So, in summary, carpal tunnel syndrome is a common condition. It's a compressive neuropathy of median nerve within the carpal tunnel. Middle-aged female are commonly affected, and there are certain precipitating factors such as repetitive wrist movements and vibration, etc. And the medical conditions, for example, diabetes, hypothyroidism, are commonly associated. Clinically, there is a clinical features include there is sharp shooting pain across the distribution of the median nerve. There may be numbness, there may be weakness of the grip strength, etc. There are tests such as Durkin test, Fallon test, Tinel test are confirmatory tests which are useful in carpal tunnel syndrome. Nerve conduction studies are useful, which show increased sensory as well as motor latency and decreased velocity. And the treatment include conservative as well as operative measures. Conservative measures such as night splint, anti-inflammatory medication, injection of local steroid into the carpal tunnel, as well as operative treatment, which is either open or arthroscopic method. Commonly is the open method of releasing of carpal tunnel, as we discussed already. So this concludes the topic of carpal tunnel.